come in.
Good morning. My name is Kateria. I will be your nurse for today. I close the door to give you privacy. I'm going to wash my hands before I start. Can you please tell me your name and birthday?
Maria Robinson, July 10, 1985.
Let me verify if that's correct. And that is correct. Can you tell me your location?
Michigan Hospital.
Okay, that's correct. Do you know the date?
June 2023.
Okay, that's good. So what I will be doing today is reassessing your pain because you came here for abdominal pain. Can you rate your pain from a 0 to 10, 10 being the worst pain?
A 3.
Okay. Can you describe your pain? Is it aching, dull, stabbing, pressure?
Like a dull.
Okay, good. And what I will be doing today will be a head to toe assessment. I will be checking your head, your body, and I will be checking your vital signs. Okay. So I'm going to start with your temperature. 98.4. Let me write those numbers. I am going to check your pulse and oxygen level to make sure everything's good. As I'm doing this, I'm making sure that you're breathing good, that your airway, there's no blockage, no interference, and your circulation, that you're receiving the adequate oxygen. Keep your fingers straight. So for your oxygen, it's 98. That's within normal limits. And your heart rate is 70. I am going to do your blood pressure. Of course, before doing this, I will check your height and weight to make sure everything's okay. Do you have any allergies to medication?
Tylenol with pudding.
Okay, sounds good. Good to know. Do you know what usually happens with that?
I get a rash and I get swollen.
Okay. So stay away from that, right? I am going to clean my stethoscope with an alcohol pad. Put your arm straight. (98/62). Does that sound like your normal numbers? Okay. Sounds good. Normal limits too. I am going to listen to your lungs, heart rate, and abdomen. I will make sure that there's no gown or clothing because any clothing can reduce the sound or interfere with the sound. I want to make sure that her lungs are clear, that there's no rhonchi, no crackles, no diminished lung sounds. And before starting, I am going to assess her head. Any tenderness? Okay, there is no lesions, no masses, no dents that can indicate trauma or disease. There's no manifestation. As I look at her eyebrows, they're symmetrical. Her eyelids, symmetrical. Eyelashes are good. Her sclera is white. There's no jaundice, which could indicate liver disease. Her pupils are equal. Okay. Can you please smile? Frown? Open your mouth. Okay. Go ah. Okay, so mucous membranes are pink and moist, and there's no signs of stroke or facial weakness. Okay. I am going to shine a light in your eyes just to see if your pupils dilate accordingly. I am going to close the curtain and dim the lights. Okay, and pupils accommodate to light, and they were able to dilate accordingly. Going to open curtain and turn the light on. So what I'm going to do, I'm going to hold a flashlight. You're going to look straight ahead, and you're going to follow the flashlight with your sight, not your head. Okay? I'm going to stand about 12 inches. Okay, and eyesight was good. Patient was able to accommodate, follow the light accordingly. There was no signs and symptoms of cranial nerves abnormalities. So now I'm going to listen to you. Of course, I cleaned my stethoscope. I will do it on the skin. Deep breath and straight. I'm going to listen to your lungs, lateral. And take a deep breath. Good job. This side. Take a deep breath. Take a deep breath. And take a deep breath. Good job. Lung sounds are clear. There's no rhonchi, wheezes, or any crackles. There's no diminished lung sounds. The chest is symmetrical. There's no accessory muscle used. No nasal flaring. Patient is not showing any signs and symptoms of respiratory distress. I'm going to listen to your heart rate for a full minute. Okay, your heart rate is 62 is regular. There's no tachycardia, no bradycardia, no heart murmur, no insufficiency. I'm going to assess your respiration. And your respirations is 18. It's normal. I'm going to listen to your lungs. Posterior, please. And again, you're going to sit straight. Of course, I will listen on skin. to avoid any sounds from being reduced or interference. Take a deep breath. Good job. I'm going to listen to your lungs laterally. Take a deep breath. Good job. Another deep breath. Another deep breath. One last deep breath. Okay, and lung sounds are clear to auscultation. No signs and symptoms of rales, rhonchi, wheezes, or any diminished lung sounds. Any of that can indicate infection, inflammation, or a collapsed lung. Can you squeeze my 2 fingers? Good strength. Follow me. Up, down, and like this. Patient has full range of motion, no signs of muscle weakness or muscle tone. I'm going to feel your pulses, your carotid, your brachial, and radial. That's a 2+ bilateral, is strong. 2+ bilateral. 2+ bilateral. Check your capillary refill. It's good. Brisk. Okay. It's good. It's brisk. Assessing skin turgor. Patient has adequate hydration. So look at her skin. Her skin is within normal limits. It's warm. There's no abrasions. There's no bruises, no rashes, no redness, no signs of infection. Can you please lay down? I will be also assessing for edema. There is no edema. No edema, no discoloration. The skin tone is even. I will be feeling your pulses. Two plus bilateral. 2+ bilateral. Check for capillary refill. It's good. It's normal. I'm going to listen to your bowel sounds. Make sure that they're normal, that her belly is soft, non-distender. Also looking for any rashes, any masses or lesions, or any abnormal findings. Are you able to bend your leg before it starts, just to make sure you have good range of motion? Any pain or discomfort?
No.
Okay, patient has full range of motion. Listen. Normal bowel sounds. It's not hyper, it's not hypo, and there's no absence bowel sound. Everything is good. I'm gonna feel any pain and discomfort.
No.
Any pain and discomfort?
No.
Out here?
No.
Anything bothers you?
No.
Okay, and the stomach is soft. It's non-distended. If my patient has an IV, I will make sure to assess the area to make sure that the skin is intact, that is dry, that there's no redness or inflammation, that there's no infiltration, no leakage, and that the syringe, the needle, I'm sorry, the needle is in the adequate place, that it did not come out. I will make sure that my patient is receiving the correct fluids or medication. I will make sure that the flow rate is correct. If my patient has an O2 Oxygen, I will make sure that the oxygen is working appropriately, that is the correct flow rate. I will make sure that the tubing, including with the IV, is not kinked or twist. If my patient has a dressing or a wound, I will assess the area to make sure that the skin is intact, that there's no signs of infection, that there's no redness, no inflammation. I will assess for the drainage. I will look for the color, consistency, and amount and smell to make sure that everything is good. I will also look at the skin, that there is signs of healing and that there's no necrosis. If I were to find any abnormal findings or even in the vital signs, any abnormalities, I will document and report that to the healthcare provider. My patient has been cooperative and she's been doing good, and there's no abnormalities.